Hi, everyone. Thank you so much for joining us. My name is Madison Hammett. I am with the Illinois ACEs Response Collaborative. I'm going to get us started now. All right, thank you. And hopefully you are all in the right place. Today we will be hearing about the Campaign for Trauma-Informed Policy and Practices National Trauma Campaign. Again, my name is Madison Hammett with the Illinois ACEs Response Collaborative. Let's start it. There we go. There we go. Okay. And it should go without saying, thank you for for all of your patience with any tech issues that come up. As you can imagine, we are all doing this from our homes and we are spread across the country. So thank you in advance for your patience with any delays. Just really quickly before we dive in, I want to let everyone know what you'll be getting after the webinar. We'll be sending y'all a short survey, ways you can participate in the collaborative, links to our website with some policy briefs and other materials. And you'll also receive a recording of this presentation, as well as a PDF of the slides and a link to register for our next webinars. If you have any questions or comments during the webinar, you'll see on the side of your screen a box to enter those in. We'll be monitoring that throughout the presentation. So please feel free to ask any questions. We'll have a Q&A session at the end of the presentation. And we are so excited to see so many new faces on our registration list. So just a quick background about who we are. Health and Medicine Policy Research Group is, as the name suggests, a policy and research organization that is dedicated to health equity throughout the state of Illinois. And it is home to the Illinois ACEs Response Collaborative, which is who we are. And we are as the name suggests, a collaborative that is working to catalyze this cross-sector movement to prevent trauma and promote thriving across the lifespan throughout Illinois. And we do that through three main umbrellas. So we do that through capacity building, which is education, trainings, things like this webinar. We also do it through research, translation, and dissemination. So briefs and that sort of thing. And then our big one that we're going to talk about today is through policy and advocacy. And as a part of that, we have done things like what you see in front of you, our trauma-informed policymaking toolkit. And this is what's created to help policymakers, advocates, people who want to see more trauma-informed legislation. This was created to help them dive deep into the idea of what is a trauma-informed law, what is a trauma-informed policy. And so we provided this guide and what we see really as the pieces and the key parts of that. So the ideas of safety, trustworthiness and transparency, peer support, collaboration, strengths-based approach, and importantly, social justice approach. Oh, I skipped ahead there, sorry about that. Got too excited for our speakers there. And part of that policy work is something that we want to give a plug for. Coming up on May 15th is our second annual Trauma-Informed Awareness Day here in the state of Illinois. You see our graphic there from last year, which was the first of this celebration really of the trauma-informed work that's being done throughout the state of Illinois, both on a legislative level, but also, you know, the day-to-day work that so many community activists and practitioners, community members do. So we hope that you will be a part of that celebration on May 15th. As you can imagine, in the wake of COVID-19, it is going to be very virtual. And so we have a hashtag, we have hashtag trauma-informed Illinois. We'll also have our social media toolkit, which will have ways that you can get involved. We'll have two virtual trainings, the first of which will be on Wednesday, May 13th, Trauma and Trauma-Informed Practices 101. And then our new historical and community trauma training will be on Friday, May 15th. And we hope that you will join both of those trainings. You'll receive links to both in your follow-up email. And then without further ado, our speakers, we are so excited to have a panel from CTIPP with us here today. Jeff Hilde is an attorney and the policy director at the Sumner M. Redstone Global Center for Prevention and Wellness at George Washington University's School of Public Health. We also have Jesse Kohler, who is recently accepted a position as an advocacy associate at the Council for Strong America and is also on the board of CTIPP and the fundraising chair. Marlo Nash is the National Director of Partnerships and Policies at St. Francis Ministries in Washington, D.C. And Dan Press is an attorney and the co-founder of the Center for Trauma-Informed Policy and Practice, where he also serves as chairman of the policy committee. And as you can imagine, those are very short, edited down biographies. We are so excited to have such an accomplished and dedicated panel. So without further ado, Dan, I am going to turn it over to you, and you should be off mute now. So.
Okay. Am I off mute?
You sure are. We can hear you loud and clear.
Okay. Wonderful. Well, thank you, Madison, and thank you, Laura, for putting this together, and thank you, everybody in the state of Illinois working on trauma-informed initiatives. When you described your collaborative, you were really describing CTIPP. All the things you're doing is what CTIPP's trying to do, and except you've been at it a lot longer than we have. So congratulations on everything you've accomplished. We hope when we're around as long as you have been, we can be as accomplished as you have. The CTIPP was created in December 2016 by a group of trauma-informed researchers, advocates, many of whom had been working on trauma-informed issues even before the ACE study came out. I didn't realize there was activity back then, but I've since learned there was a lot going on even then. And it was created exactly the same reason your organization was created, to provide a cross-sector entity to advocate and educate on trauma. What we found is while there are a number of organizations that talked about trauma, they all were talking about it on their own specific sector area, education or social services or law enforcement, but there was no organization that cut across all of those areas and had as its primary focus promoting trauma-informed programs and policies. So CTIPP was created. It's an all-volunteer organization. All of us have other jobs and do this in our, I would say, spare time. We don't have any of that, but and we all do it because, like all of you on this call, are passionate and believe that trauma-informed programs can make such a difference in this country. As its name indicates, CTIPP has two goals. I'll take the second one. The first is practice. And what that means is our long-term vision is to have every school, every law enforcement agency, every social services agency, every welfare program, really every business in this country, every government, trauma-informed. And it's a long-term goal, but we have this vision of it being like a whole string of Christmas lights all over the country, lighting up, bringing the wisdom that the trauma-informed science has taught us to, excuse me, I just got to fix my screen for a second, to deal with and improve so many areas. The World Health Organization recently came out with a study that found that ACEs cost this country $740 billion just in healthcare costs. $740 billion a year in healthcare costs. Imagine if we can implement trauma-informed programs and use all that money to deal with problems that aren't ACE-related. Because right now, that $740 billion is being used to deal with the effects of trauma, not being spent to prevent trauma or to mediate its effect. So there's a huge need out there and a huge opportunity. We also did some calculations and concluded that trauma ACEs cost the United States about 650,000 lives a year. If you take all the people who, for example, in the area of substance abuse, approximately 60% of all people with substance use disorder have multiple ACEs. You take all the people who die from substance abuse, add it to the people who die from alcohol abuse, and people who die from diabetes and obesity and the other results of trauma, and it added up to 650,000 people a year. So in addition to saving money, making this nation trauma-informed is going to save a lot of lives. So that is CTIPP's number one goal, and we get there through a number of mechanisms. We run a monthly call that brings together trauma-informed programs from around the country, where we have presenters talking about innovative programs they're engaging in order to promote networking. And we've just started a new initiative of working with ACES Connection to create regional coalitions of trauma-informed coordinators so they can share ideas, share information, and it gives CTIPP a vehicle for getting information out quickly. And we're going to be talking to Madison and Laura later about one in the Midwest. We're going to have our first gathering of statewide coordinators in the Northeast this Friday. So we're trying to promote trauma-informed programs around the country. Our second area, just like yours, is policy. And that's really one piece of getting the nation to become trauma-informed. But it's an important one because, as Willie Sutton said about banks, Congress is where the money is, and we need money to pay for the trauma-informed programs. Right now, with only a few exceptions, none of the laws that Congress has passed to create social health law enforcement programs have incorporated trauma-informed concepts in any way. So we have we've been spending the last 3 years trying to get Congress to implement trauma-informed concepts. The state of Illinois has really been the gold standard on that. Your delegation has led the way. It's really so admirable. Senator Durbin, Senator Duckworth, Congressman Davis, all have introduced and advocated for trauma-informed programs and work to educate their colleagues on trauma science. They really have been the lead in this country. So thank you for sending such great leadership to Washington, where we desperately need it. One of the things we learned early on is Durbin and Duckworth and Davis really represent a very small minority of Congress people. The vast majority of them aren't aware of trauma science, and as a result have not even thought about incorporating it into their legislation. The other thing we found was that while there are a lot of great trauma-informed programs around the country, a lot of them were not educating their congressional people. They were doing great work at home, but never really thought about, gee, we ought to take our Congress people on tours of what we're doing or brief them on it. So there was a disconnect. So to fill that disconnect, we created a campaign to educate Congress about trauma, with the expectation that in a year or two, when that process is done, we can present to Congress comprehensive trauma-informed legislation that would incorporate trauma science into every aspect of federal programs, prevention and early detection and resilience building and treatment and workforce development and our mind, most importantly, development of community entities like yours, because ultimately trauma-informed programs need to be developed at the community level. So the community and statewide organizations that are promoting trauma are really the key to the success. So we have a long-term vision. COVID-19 has clearly created some new issues that have caused us to deviate from that a little bit. But we have launched in February a campaign to educate Congress. And I'd like to turn it over to Jesse to talk about the campaign.
Thank you, Dan. Madison, if you want to go to the next slide, you'll see a lot of what Dan was just talking about in terms of our strategy and our plan now. When we initially launched, as Dan was saying, we thought that this was going to be a multi-year process with really two steps. Having people in all 435 legislative districts join in a network to send calls to action from the core team over to their congressperson and ultimately get them to join the House Trauma Informed Care Caucus, which would then lead to the comprehensive trauma-informed legislative vision that we are also working on. That would be the vehicle through which that would pass. COVID-19 has forced us to pivot, and so my colleagues Jeff, Hilde, and Marlo Nash will be discussing some of the COVID-specific calls to action and information for you all to know to navigate certain resources that are available to your state and your communities. What we really need from all of you is, like Dan said, CTIPP has been trying to do this for about 4 years now, and we've been unsuccessful because we haven't had voices from all of the communities that exist throughout the nation, which is why having at least one person, if not more, in all 435 legislative districts is so important. Our voices are not nearly heard at the same level as yours when you speak to your congressperson as a constituent. You have such power in being able to convey messages to your elected leaders. So that is why this networking effect that we are trying to create is so important. So Madison, if you would go to the next slide, you'll see our website where you can get all of the toolkits that we'll be discussing, the calls to action, different resources that are available are all available at ctipp.org/National Trauma Campaign. So Madison, if you don't mind pulling that up for everyone who's on the call today, anyone is able to go to our website and go to the National Trauma Campaign tab, which is going to have all of this information. So as we scroll down, you'll see our very nice infographic. The top, the Join the Campaign section, is really what Dan was talking about, a lot of that background information, how the campaign works. On the next section down, you're going to get our toolkits. We encourage you as liaisons and organizations to help us grow the campaign. There's strength in numbers in this campaign. If there's one person from a congressperson's district reaching out to them as a constituent, that's powerful. If there's 10 or 20 people or organizations reaching out on behalf of the campaign, obviously that magnifies the voice. So that's the toolkit to grow the campaign. The COVID-19 toolkit is a lot of what Marlo and Jeff will talk about. And then the House Trauma Informed Care Caucus toolkit is what our initial plan was, and we will get there. This next section that Madison just pulled up is where you can actually sign up to become a local liaison, which is the person who is going to communicate the calls to action directly to their congressperson's office, or as an organization, which also organizations can communicate that call to action to their office, but they can also leverage the networks that they have available to again magnify the effect of that call to action as 10, 20, even more people are reaching out with the same ask to their congressperson. And then if we scroll down below where you're able to sign up, you're going to get a lot of resources available. So as you can see, the top resources are all COVID-19 resources. The Dear Colleague letter that we'll talk about is on there. The PowerPoint that you're looking at right now, if anybody wants to see these slides, is that COVID-19 Response and National Trauma Campaign tab right there. And then as we continue to scroll down, you'll just see that there are more resources. The infographics we certainly encourage you all to use. It is a great way to convey messages in sort of a more, it's a great add-on to your narrative and you talking to your congressperson. It's visually appealing. They're very nice. So that's the website. Again, section 3, we certainly encourage you to visit, and please, please, please sign up and let your friends, peers, colleagues know to sign up as well. And Madison, if you do not mind going back to the slides now, we will show you an example of the of one of the infographics later. But that's really how you can sign up for the campaign. That's how you can get involved. We encourage you to look through the toolkits and resources to see, different ways that you can communicate these messages. Maybe there's some resources there for you to advocate and utilize in your communities as well. Please feel free to share it, use it as much as you can. And with that, we'll head to the next slide. And I will pass off the speaking to my colleague, Marlo Nash.
Thank you, Jesse, and good morning, everyone. It is, I'm very grateful to be here with you today. I'm Marlo Nash. I'm the National Director of Partnerships and Policy for St. Francis Ministries and a member of the National Core Team. St. Francis Ministries is a nonprofit organization that provides hope and healing by rebuilding and building well-being for children and families, primarily through the full continuum of services that are connected with the child welfare system. We are a national and international organization. We have on-the-ground services in Kansas, Nebraska, Arkansas, Oklahoma, and Texas. We also have an office in Illinois, and we are members of the Illinois Collaboration on Youth. So I also want to introduce myself as an in-state and our organization as an in-state partner with you. So part of my work nationally is to both partner and provide consultation and technical assistance across the states. So I'm very particularly excited to be here with you all today for the possible opportunities of our continuing the kind of work we're talking about today through the national campaign and perhaps even through state level partnership. So between my colleague Jeff and I, we are going to talk to you about opportunities within the response to the pandemic. And I really am trying to use the word opening more than opportunity. So forgive me. So openings. My part of the presentation will be going through with you the laws that have already passed and what opening there is at the state level to leverage some of, in particular, the appropriations that were put forward to states and local communities through the laws that have passed. And then in a minute, Jeff will be talking to you about the advocacy efforts that still needed in Congress for doing more to address trauma in future federal COVID bills. So and I think the one thing that I would say specific to Illinois is that you all, as Dan mentioned, have a huge champion for having trauma-informed responses and approaches and programs in Senator Durbin. They're very active in this space, as you probably well know. And so I think there's a particular opening for you all here. And you have clearly, by the number of people who are on this webinar today, you have a very mature and healthy and sizable network in Illinois. So what I'm going to talk to you about, you may have more opportunity in Illinois even than in other states. So just to kind of review at a high level and talk a little bit about analysis through the lens of trauma science of the laws that have already passed, we know that the COVID pandemic is affecting physical, mental, and economic health and every public system. In March, Congress passed 3 new laws in response to the COVID-19 pandemic, and they are now discussing a 4th bill. Some of you may have heard the news that at the end of last week, they passed something that's being referred to as the CARES Act 3.5, because it is an additional piece of legislation for responding to COVID, but it was primarily done to put more money into the small business loan. So it didn't really have any new developments relative to Health and Human Services. So when we talk about that Congress is discussing a 4th bill, we're talking about something that we think is coming end of May, early June, and is what Jeff will talk to you about in a moment in greater detail. So right now we're talking about the 3 major laws that passed last month. And I just want to give you some context about why it's an important opening for you to think about for your work, not just because of what I'll talk about in a minute, which is the flexible funding that has some contemplation for spending the money on mental health supports or supporting social emotional needs. But it's also important for you to recognize this opening in the context of how much money is going out in response to COVID and kind of what is ahead. So this is the purpose of these next few bullets, is really just to give you that context of the scope of this for the federal government. So this is the largest stimulus package since the mid-1930s, and you'll remember from your history class, the mid-1930s is the package of multiple bills that we now refer to and know as the New Deal. So the largest stimulus package since the New Deal. Our federal revenue last year for the United States for 2019 was $3.5 trillion. And last year, the US spent $4.4 trillion. So last year, pre-pandemic, we already were spending $1 trillion over the revenue the country brings in. The first round of COVID response, so those 3 laws that were passed last month, represent half of all that was spent in 2019, again, pre-pandemic. So everything our federal government spends money on, just the 3 laws that were passed that last month represent half of that. So you can see, you can just quickly do even conceptual math. You don't have to actually add it all up, but that we are on a track to really outspend our revenue because of the COVID crisis. So the impact of that, especially because at the federal level, we're still the fourth bill they're talking about still being response. And if you've done any disaster work, you know that there's a period of response, which is handling the immediate threats and problems. And then there's recovery, which is all that it takes to get back to whole after the physical threat is over. So there's going to be something has to be done at the federal level about the amount of spending. And we already are hearing, as I'm sure you're hearing, that state budgets are going to be strained because of this. So there's a new financial reality of public spending that then relates to your goals around having trauma-informed systems in the state of Illinois, because it takes at least some money to do that. And that being able to find that money is going to be a challenge, which is why what I'm going to talk to you about now, teeing up for you really is there's an opening now with these 3 bills, and that's what we want to go over with you, because it's going to take state and local advocacy to attempt at least to put forth to the decision makers for the pots of money that are already coming to your state from the laws that were passed last month, to try to direct those through a trauma-informed lens. So if you'll go on to the next slide. So here's some more about those laws. None of the 3 laws that have been passed have any explicit specific language about trauma-informed approaches. Mental health is referenced, as is social emotional health, but most frequently through that package of laws, the emphasis is on treatment and counseling, and not as much emphasis on, and no explicit emphasis on kind of a public health approach of having trauma-informed systems as part of the early part of an overhaul continuum for how we address the trauma that many are experiencing because of the crisis. But because mental health is contemplated in some of the language, that's the opening for directing resources toward trauma-informed approaches and programs, such as in the Education Stabilization Fund, which is one place where it talks about some of that money can be spent on addressing the social emotional needs of students. If you'll go on to the next slide, please. So the other thing, in just sort of a high-level analysis of that package of laws that was passed last month, that the issues that cause trauma or result from traumatic experiences received relatively small allocations. So family violence, child welfare, substance use, and suicide prevention were all mentioned in laws that passed last month, but they received allocations in the millions, whereas responding to the physical threat of this crisis was received allocation in the billions. And that's that difference, as I was saying, between response has to be right now on the physical threat of the pandemic, and mental health is getting less money now, but that's something that really needs to change, as we all know, going forward, because as one article I read called it, we have a silent epidemic going on right now, which is the mental health impact of this pandemic that's not getting as many resources or as much attention or as much action through policy. And then the last thing at an analysis level is there's no requirement for coordinating those funds within the state. So there's nothing that the federal government said to say, you know, these pieces need to go together in, say, a trauma-informed approach. But again, at the state and local level, you have those opportunities. So go to the next slide. So this is not a comprehensive overview of the laws, but we wanted to point out some of the ways that can, we just want to put into your thinking and your knowledge bank some of the openings that you could be considering. So one is the community services block grant. There was money put into that will flow through community action agencies. So are your community action agencies trauma informed? And is that work that could be done with some of that funding? The community development block grant is going out to support to work against the issues of housing and homelessness. So is there an opportunity there to bring a trauma-informed lens to that work that is funded through the community development block grant? The child care development block grant is going out. It is largely focused on keeping child care centers accessible and available, particularly for essential workers. So there is not as much flexibility in that money toward addressing mental health, but it's another system that you all could be thinking about in terms of in this process, working with them to try to bring a trauma-informed lens to implementing the provisions they are to keep the programs accessible. The Education Stabilization Fund, as I mentioned earlier, the Governor's Emergency Education Relief Fund is a fully flexible fund that does list in it, references mental health as one of the things it can be spent on. And then the Elementary and Secondary School Emergency Fund is another one that contemplates being able to spend some of those funds to address mental health and social emotional needs within the elementary and secondary school funds. There are funds in the Education Stabilization Fund for higher education. Those are more directed to financial supports to students and to universities. So there's not an emphasis in there on social emotional health, but it is another system that obviously needs to be trauma informed in its response for its students and educators and the professionals who work in those systems. Next slide, please. So I put in this slide to make two points. One is that just, you know, there are other resources, thankfully, that are going out through the federal laws for nutrition. Those are not funds necessarily to that might be able to apply to trauma-informed approaches, but they are places that are being supported and strategies being supported that could be done through that food distribution done through a trauma-informed lens. So it's an example of a touch point with the public that you could be thinking about. Then this next point, community health, I really put in here to demonstrate the point I made earlier, the difference between what was in those laws to respond to the physical health threat, which is that 1.3 billion you see going to community health centers, and then community behavioral health clinics. It was contemplated that they need some resources, but 250 million toward increasing their ability to respond to mental health care services. So more needing to be done in the future, but knowing that the behavioral health clinics that's another place to enlist and engage around addressing trauma. Next slide, please. And then this last one is just, again, to let you know what was in the law that focused on specific kind of issues or populations. Again, to just plant a seed in your thinking about where might you go or what populations might you be thinking about to think about addressing the trauma they're experiencing and building resiliency. So this is kind of to let you know who's on the minds of Congress as well. So homeless, runaway and homeless youth, immigrants, a lot of the reference to immigrants in the laws were really for the purposes of excluding them from benefits. So that's something for you to think about for that population and the trauma they're experiencing. Incarcerated individuals, seniors, individuals living with disabilities, and Indian country. So again, this slide is in here to let you know kind of who Congress was thinking about giving some particular additional supports to, and who obviously is experiencing most likely compounded trauma because of COVID. Next slide, please. So the opportunity, the opening for you to take action, the timing is now. So this is right now to think about what can be done largely through virtual means to bring a trauma-informed lens. What could you propose to those decision makers over those pots of money that could be worked into their plan for spending that money that would help make the state and the systems be more trauma responsive? So they'll need your ideas, their concrete suggestions. But just keep in mind that these monies are not necessarily about when everything goes back to what we hopefully is a better normal when everything goes back and the social isolation is over. But also, the money is immediate. And so thinking about what can be done and addressed right now. And then for you to reach out to influencers and decision makers over those pots of money. And in some cases that varies, and it varies for the different provisions in the law. And it also will vary in your state as to how those monies flow down, particularly in your state. But an example would be for the education stabilization, elementary and secondary education. 10% is going through the state education authority, but 90% will be distributed through local education authorities to your local school districts. So that's different decision makers than who is getting the governor's emergency and education relief fund, which is going through the governor's office. So you may have a secretary of education who will be the decision maker on that fund. So it would be for you all to kind of think about who are those influencers over those federal funds, and how could you get to them and propose concrete suggestions. So we've put together a toolkit to try to be helpful for that. Happy to answer questions today and after today as well. If this is all of interest to you and you want to try to take action, I just can't impress upon you enough that the money is already flowing to states. So it's an opportunity, it's an opening that is upon you right now to try to leverage. And with that, I think I'm handing it to Jeff to now talk about advocacy opportunities for the 4th federal COVID response bill.
Great, thanks Marlo, and hopefully everyone can hear me loud and clear. My name is Jeff Hilde. I work at the Redstone Center, which is part of the George Washington University School of Public Health. We run a national network and learning collaborative called Building Community Resilience. and we're really excited to be part of the CTIPP campaign, and really excited to be and grateful to be on the webinar with you all today. So I'm going to talk about sort of the evolving federal response and where there may be openings, to use Marlo's language, for advocacy. And before I do that, I really want to point out why our advocacy and policy work is so important right now. First, we're already seeing the impacts of the pandemic in increases in confirmed child maltreatment cases, in some places skyrocketing increases in calls to domestic violence and suicide hotlines and support networks. We see the data coming out in regards to alcohol sales, which have also skyrocketed during the quarantine and stay-at-home orders. And finally, we know the unemployment epidemic that is occurring now and which is likely to continue into the future. And so we know that the pandemic is having real impacts on children and families, and what my colleague Dan has referred to as a coming trauma tsunami. Other folks have referred to kind of the mental health as being an epidemic within the pandemic. And we also know that the burdens of the epidemic are not being borne proportionately, that there's some populations that are and will continue to bear a disproportionate burden of ill health related to this pandemic. That can be from anything in terms of who is able to work from home. Some recent data I saw showed that for those with a household income of less than $40,000 a year, a third are able to work from home, compared to about 2/3 of folks who earn over $90,000. We also know that frontline workers are experiencing incredible levels of vicarious trauma, those who have lost their attachment to the workforce. And then we know that minority communities are bearing a disproportionate share of death and hospitalizations related to COVID-19. And we also know that inequities that existed before in our communities are being magnified, and that there's trauma associated with the ongoing pandemic, but that certain communities are going to have the supports they need to bounce forward because those existed prior to this pandemic, and the places that are being hardest hit are least likely to have those supports. So it's really important that we think about the communities and populations that are going to be most impacted this and respond accordingly. Other reasons why our advocacy is so critical, Marlo mentioned the new financial reality of states. Both state and local governments are going to be seeing budget cuts for the foreseeable future. And so that points us to the need for a continued robust federal response and recovery effort. We also know that if the regular safety net organizations, including lots of NGOs, are facing financial crisis as well. And we see that from childcare centers potentially closing down to longtime nonprofits that are losing their donation and support base. As Marlo mentioned, thus far, trauma has not been a specific focus of the federal response. And even on the mental health side, my rough calculations show that federal resources for mental health make up less than 0.5% of the total federal support thus far in the 3.5 or 4 bills and the amount of healthcare spending. So again, mental health, less than 1% of all that healthcare funding coming out. So there's a huge gap to fill there. And then the unemployment number. So we know from the Great Recession that there's a direct link between unemployment and increases in suicide. Some studies have pointed to a 20 to 30% increase in suicides related to unemployment during the Great Recession. And we also know that unemployment has an impact on opioids and substance use disorder. One study found that a 1% increase in unemployment leads to a 3% increase in opioid overdoses. So we can imagine as the economic fallout from this continues, the impact it's going to have in those areas. So there's this great need to educate and engage congressional offices, and others have mentioned, you all are starting from a great point because you have at least certain members of your delegation who understand trauma science, who understand the long-term health impacts of ACEs. And so those are folks who are natural champions, who are also going to be open to new ideas that you see emerging out of communities. So keep that in mind. And then we also need help to kind of grow the network. This is hopefully going to become a viral effort where we've got grassroots folks all around the country who are able to lift up promising practices from their communities. And our goal is to help translate those using our tools into actionable initiatives for policymakers to take. So I think we can go to the next slide. So what's been happening thus far has been an effort to insert trauma provisions into the next phase of the COVID response legislation. And I would say there's, the way we're thinking about this is there's these number of bills that are part of the immediate response, and we expect another one of those to be coming through the pipeline later next month and into June. And then there's kind of the longer term recovery aspect of this, and the speaker has talked about infrastructure as being part of that. We certainly think that the need for infrastructure related to trauma and mental health supports is critical there. So there's this short-term opportunity of what Congress is going to do in the next weeks and months, and then a longer-term opportunity to shape the recovery. And so the tools that we've laid out, you can see them here on the slide. The importance of identifying the staff member in the office, establishing a relationship with that person, helping to set up phone calls or meetings, and then remaining in touch with them as we go forward. So that was kind of the nuts and bolts of the campaign, and that's obviously changed and pivoted a little bit in response to COVID. So next slide, please. So we've got a number of tools that you can use to educate your member of Congress. You can see the links up there on the slide, and we'll be going through some more of those in depth in a moment. Thus far, the effort has been, our effort has been focused around building support for a Dear Colleague letter that was sent last week, bipartisan, primarily from members of the Trauma Informed Care Caucus, led by your own Congressman Davis from Chicago. And that letter called for additional funding for the National Child Traumatic Stress Network and additional funds for trauma responsive initiatives in educational settings. So one of those is a grant funding stream that was part of the opioids bill that passed at the end of 2018 to provide grants to local education agencies to implement trauma-informed supports in schools. And the other would be a plus up for SAMHSA's Project Aware, which is the Advancing Wellness and Resiliency in Education, which is a grant funding stream that flows through many states, including Illinois. There's also a number of other provisions that we included in a memo to some House offices that have gone to leadership that include things like trauma-informed supports for job training programs, particularly in the youth employment space, increases in funding for law enforcement and first responders for trauma-informed supports for them, and a few other items. And then what's happening next is hopefully there will be a Senate companion to that letter, which will probably be led by Senator Durbin. And once that's live, we'll probably be issuing a call to action for the network, for the campaign to engage other members of Congress to join in that effort. And then we are also part of a larger National Child Trauma and ACEs policy group, which is made up of, I believe, about 4 dozen national organizations who have some type of focus in the trauma or ACEs realm. And we're trying to develop a comprehensive policy agenda from that group. Next slide, please. So here you can see have the list of our tools that are all available on the website. When we do an action alert, we send kind of model language for you to use. And I would say when you're interacting with your member of Congress, the best way to frame that is to talk about local work that's happening. They love those stories of innovation that's happening in their district, and really talk about the impact that your policy ask would have at home, and keep it focused on things that they care about in their congressional district. And I think we can go to the next slide. So additional campaign tools here, including a great COVID-19 video that I think is useful as you spread the word, both within your communities and networks, and also in your interactions with policymakers. And this really helps to paint kind of a clear picture of what we know in terms of the traumatic experiences and the adverse childhood experiences that are associated with COVID-19, and why there is a need for a robust policy response. And we can go to the next slide. And again, additional infographics that are available for you all. And in particular, I point you to the one on the right that shows some of the evidence of impact of trauma-informed interventions and trauma responsive interventions. These are really important to share with policymakers, particularly in the budget environment we'll be entering, where we really need to show, for lack of a better phrase, return on investment, or how we can lower costs in other areas by investing in these supports. And the other thing I would mention is, as Marlo said, it's really important to get beyond just the need for a more robust clinical and therapeutic response, but to really think about a systems level response. And I think I see we're getting close to time. So if we've got one more slide, if not, I think, Madison, we can turn back to you and do some questions.
Thank you so much, everyone, to our entire panel. This was great, and we do indeed have quite a few questions rolling in. So I am gonna just get us started on that Q&A section. And folks, if you have questions, please send them in. We are looking at them right now. So one of the questions that we had a couple of times are, what are some long-term goals that you would like to see as a result of all of this advocacy and policy, beyond the idea of, oh, legislation is trauma-informed? Like, what are some outcomes, whether they be, on individual or societal level or legislative level? What are some ideal world scenarios for y'all?
I can take a first crack. When I think about the COVID response, is that we do not, a vision I have is that we do not see an uptick in entries into the child welfare system, the substance use treatment mental health system as a result of COVID, that we are able to meet people where they are with ways to address their dysregulation before they live with it so long they end up needing deep end services or interventions. That's one I could think of.
Yeah, and if I may add very quickly, I think that Dan brought up the extreme costs that are associated with trauma, and I think that there's a bit of a disconnect at the federal level in terms of spending dollars to fix costs after the fact and not being proactive. And in that light, I do believe that one of our goals is to have more money available for trauma-informed efforts at the community level, like what Marla was just saying, where the impact can actually happen, and developing a stream of appropriations and funding to communities to support people before things get to the level that they become real issues, and start to dig into funding even more than they have to if they were dealt with up front.
Let me chip in. One of my areas that just really grabs me emotionally. I saw a presentation about a school that for less than $10,000 implemented trauma-informed programs, and they were able to reduce the number of suspensions in the school from 890 a year to 19. And that means fewer kids out on the street, fewer kids doing drugs, more kids learning. And I keep thinking every school in the country can implement a similar program. And I would love to see every school in the country become trauma-informed and put in place these programs in which both teachers and students understand what's going on in their brains when they get traumatized and how to keep it from taking over their brains. So I would love to see our schools all become trauma-informed.
Thank you. One thing that is of particular interest to the collaborative is care of those on the front lines, those healthcare workers, those social service providers who already have quite a burden of burnout, secondary trauma, vicarious trauma. I'm wondering if y'all can speak to any legislation or advocacy that y'all are working on or are aware of that specifically addresses the needs of providers and those who are dealing with COVID every single day at work.
Yeah, thanks, Madison. This
Jeff.
is Jeff, and I glossed over part of the answer to this question of trying to race through. So there's two federal funding streams that we identified as part of our efforts to inform what Congress is doing. And one is through the Department of Justice, and there's a Law Enforcement Mental Health and Wellness Act program that's only about 2 years old, that has a pretty minute amount of funding. And so that is funding that flows through to states from the federal government. So that's one area we identified. And then CDC and SAMHSA have a partnership called the National Institute for Occupational Safety and Health, which develops and disseminates resources to address the mental health needs of first responders and healthcare workers. And so we had identified that as a potential area for the federal government to invest additional resources in. Also, the National Child Traumatic Stress Network, the ask that was in the Dear Colleague I mentioned, was an increase for that, but also to focus on first responders, caregivers, and their families to provide additional supports and resources that way. So those are three specific areas we've looked at, but I think with an acknowledgement that the level of need is going to be much greater than that can probably be supported through those funding streams alone.
Yeah, and we've started drafting a vision of what a comprehensive trauma-informed piece of legislation would look like, and in it is a section to provide help for dealing with secondary trauma all across the spectrum. The amount of money this country spends having to replace teachers and police and others who leave because of burnout, it's just an unnecessary course. And in the school I described before, not only did they reduce suspensions from 890 to 19, but they reduced turnover to 1. Only 1 teacher left. And this is in a low-income school where the turnover is usually running 40%. So it's really a great investment. Whether the funds will be available, we don't know. But it needs to be done because we're spending too much money on dealing with the effects of burnout. And we now know it's not burnout, it's trauma.
Thank you both.
I would, if I could just chime in and add, just going back to the subject I covered earlier in the webinar, the money that's already out there and available, and in particular, the Governor's Emergency Education Relief Fund and the K through 12 Emergency Relief Fund, both are very flexible and both reference mental health or social emotional support as one of the things that money can be spent on. And I will just share my own personal experience in my own school district. There was a town hall meeting last night with 2 of our school board members, and I asked the question through chat, so it was limited. I had to pose my question and then just listen for their answer. So I asked the question about how they are being trauma informed, both for the students and the teachers, and as well as, you know, everyone in the system. And the response was very much about clinical and interventional. So they're, you know, they have mental health counseling for students and parents, and they have the EAP for employees. That is all great. But there was nothing in the response. I could just tell that they just had not conceptual. In fact, what they said about trauma was that trauma is a high priority for the school board, and we are thinking about how to handle that when kids come back to school in the fall. So it basically laid out that they're not thinking about how to be trauma informed now. My apologies for the dog barking. From home. Sorry about that. That your voices are needed in the education systems. They're having to think about a million different things, and I think it's fairly likely that across the whole country we're skipping over the trauma that's happening now and the ways that email communications, you know, virtual classrooms, town hall meetings, even, you know, all those things could benefit from thinking about how do we re-regulate people? What are the kinds of things they need to know right now? Because all of that is about preparing them for a successful return to the physical classroom whenever that happens. If you gloss over that and think that that's a future problem, there's an issue. So I would say, you know, right now there is that opening, but a very great need to bring that trauma lens, that trauma science into discussions about how to spend time, how to spend resources. And, you know, there are several sort of milestones over the next few months. And one of them is now. One of them is when for kids, it's when they are out of school for the summer. How are they having their social emotional needs met over the summer, and then returning to the virtual classroom or the physical classroom, whichever order that happens. And then I think that's the school example, but I think that obviously you all could think through workforce, child welfare system, court systems, you know, all the places where it's such a universal experience right now that all of those places need to be trauma informed. And yet what we're seeing as we talk to different people around the country is that we're just not there yet as a country. We're not fluent across the board, as you well know, in what it means to be trauma informed, what it means to regulate, be dysregulated, and therefore what it takes to re-regulate folks. And so that's my contribution to that question.
Thank you so much. Yeah. Thank you again to everyone. I know we still have some questions about specific legislation and different resources and references, but just in the interest of being respectful of everyone's time, I will pass those along to our panel. You'll receive a couple of follow-up emails, and including one with links and answers to questions and all of the resources you've seen here today. So I will pass those along. And I do want to do one final plug for Trauma Informed Awareness Day here in Illinois. We would love for all of our audience to be involved in that. Please watch your inboxes for resources like the social media toolkit. Join us on Twitter to tweet and talk to people across the state. And then we will have 2 trainings, as I mentioned, one on Intro to Trauma-Informed Care and the other on historical and community trauma. And you'll receive links to register for both of those. To our panel, thank you so very much. We so appreciate you joining us from across the country. Thank you again for such an engaging and informing presentation.
Oh, and thank you for having us.
Our
We
Yeah.
look
pleasure.
forward to answering your questions and working together.
Of course,
Thank you.
yes. Well, thank you everyone, and stay healthy and well, and we will see you at our next webinar. Have a great day.
Thank you.